The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. You know, I have to tell you before we get started with this show, one of our earlier interviewers, Darwin Porter from Staten Island, was saying that he actually heard from somebody from Bombay who said, I love your show. He said, how can they hear it in Bombay? I said, because it's on the Internet, and anyone can hear this in the entire world. So, welcome to our show, Dr. Mencia, and why don't you introduce your gorgeous guest this morning?
Good morning. This is Dr. Joseph. Dr. Joseph is our podiatrist who we have the honor and the pleasure of working with her. And she's an integral, important part of the team care at the Adult and Geriatric Institute.
And so for people who don't know what a podiatrist is, when you were a little girl and you decided you wanted to then one day be a doctor, and you decided you're going to be a podiatrist, and your mother said, what's a podiatrist?
Good morning. I'm Biblon Joseph. Yes, I wanted to be a podiatrist, and my mom says, what's a podiatrist? I said, it's somebody who makes you walk, and she says, go to medical school. So that was the best thing I've ever made. I love feet. They're the best thing ever. They carry us throughout our lives.
I love feet. That's a good. We have to get a bumper sticker. I love feet, right?
Yeah.
But think about this. You know, there are a lot of people. It sounds crazy. We know that women want to keep their bodies covered, mostly, breasts. I mean, people aren't going to be naked. But you know what? People feel that way about their feet, don't they? I mean, they don't want anyone to see their feet. They're embarrassed or something.
So that's the reason why at Adult Geriatrics we want you to come and we will take care of your feet. It is one of the most important part of your body. With the feet, we can see a lot of things from the body. So if we take good care of them, the better they look.
Absolutely.
Well, so Dr. Mencia, I mean, what I just said, it's true. I would just tell you it's a little personal, but I have to tell you, when I got divorced, my first new boyfriend loved to do foot massage. Mm-hmm. And it put me out of this world. He knew what he was doing. I mean, it was wonderful, the foot massage. But, most people don't get foot massage. They think of taking your hands and massaging. They don't massage your feet. I mean when you go to the doctor.
Yeah, I do travel a lot, and when I go to Thailand and China, when you do acupressure in the sole of the feet, you have mapping of the entire body. So when you do massage, basically what you are doing, you're working on different parts of the body. And what Dr. Joseph said makes so much sense from that point of view. Because, like she always said in the practice, you don't get feet that walk in there by themselves. They are attached to a body. So the feet is telling her how well that person is taking care of them, if the person is diabetic, how often he or she need to be attended to. Because our objective at the center is to prevent disease. We don't want to see our patient losing toes and, losing their nails. And, we want patients to remain, regardless of their age, to remain active. Dr. Joseph, when it comes to age, a lot of people, because I see it on my patient. I see young patients that come in. I had the other day a 38-year-old patient I sent to you. And when I was telling him, well, because of your diabetes, I want you to see Dr. Joseph. And he goes, there's nothing wrong with my feet. And I said, well, that's the objective. That's what I want to do.
We want to keep it that way.
Exactly. Let's talk about age. At what age should we start seeing a podiatrist?
Well, I always say the younger, the better. But definitely when you are in your 20s, 30s, 40s, 60s now, or the new 40s, so we have to stay young. Because the feet will tell us a story. They tell us how hard you work, how much you walk, what you don't do. Because if you are not very active, we can see that too. The bones will show it. If we have osteoporosis, we can see that also on the bones. And if you have diabetes, we'll be able to see that with the skin, with the trophic changes, and all that good stuff. So feet are very telling. So that's why the younger you start taking care of them, the better. Because I always do that analogy. Your feet is like a car. You have a tune-up to the car every 2 months. So definitely the feet, we have to take the same good care.
Yes.
So if our patients are on Medicare, how frequently can they come to you, Dr. Joseph, and have Medicare pay for this?
Medicare will pay for feet checkup every couple of months, every 61 days. If you have diabetes, it's for it. If you have problems with circulation, it pays for it. If you have pain, it pays for it. So therefore, we have to take care of the feet. There's no reason not to. Because as we age, we have a tendency to see different changes. We see sometimes the bottom of the feet, it hurts a little bit more. There's a burning sensation sometimes. Or sometimes we even have chin splint, the front of the leg.
Wait. Go back to the burning. I want to talk about that because...
That's very common.
Oh, yeah, because when I do more walking than sometimes 2 miles, I notice that my feet are starting to burn. Why is that happening?
Absolutely. What's going on is that sometimes we lose the fat that we had at the bottom of the feet to give us that extra cushion. So we still need to be active. The way we do it in the office, we do conservative approaches. So we try to replace the fat by putting a pad, or if we need something more structured, like a special orthotics with insert to prevent. It's going to be like a shock absorber. So like that, we relieve the burning, we relieve the pain to the bones, and we have a better day at the end.
So there is a reason for that, and people
Absolutely.
shouldn't be afraid. They just need to get some sort of help.
Relief,
well,
yes.
Dr. Mencia, when how do you know when you're interviewing someone? Do you ask them all these questions before you send them to your podiatrist?
Absolutely, and then because the patient, even if it's a retired physician, they are not the doctor now; they are the patient, and sometimes they don't put the whole puzzle together. So they come in and they say, well, I had a heart condition and I have diabetes and I have. So when they start going through their medical history, and sometimes they don't even know what they have, but by looking at the medication that they have been taking, we can make infer into what diseases they have. And then the idea is to take those patients and say, well, you have to have a screening with the podiatrist. And the way I see it, and the way we should all see it out there, is that you go to your eye doctor at least once a year to get your eye exam. Hopefully. You get your colonoscopy as a screening. The podiatrist is another part of your body, and it's a very important part. I get patients that come to me sometimes with hip pain or knee pain, and it all comes from bad care of their feet. They have never seen a podiatrist to help them. And they get surprised when I say, well, we're going to take care of the pain on the hip, but you need to see the podiatrist too.
Okay, so Dr. Joseph, are you going to tell me that I shouldn't be wearing high heels anymore?
As a matter of fact, I have a very good joke. The other day we had a patient come to the office and she was wearing flats, and she said, my leg is killing me. And Dr. Mencia says, I know what's going to help, but let me just double check with Dr. Joseph. And sure enough, the two of us went to the room, and she had what we call a tight Achilles. And we looked at her, we said, you know what, you're going to be better off on a 2-inch heel. And she laughed, and she was so happy about it. We do what's best for you. Sometimes the body dictates what to do. If you have a tight Achilles, we cannot put you on a flat shoe. You need something to keep you up. So, of course, we cannot say go to your 6-inch, 7 inches heel. That's a different story. Because at this point, you're not stable anymore. But a 2-inch wedge sometimes make wonders depending on the type of foot that you have. So that's why it's good when we see you, we examine the whole foot, the whole body, and we see what's causing the problem.
Well, what are some of the very severe problems that you see when people come in? I mean, we talked about the nail getting very thick, and I think you talked about fungus.
Fungus is very common. Fungus, usually what it does, it's an infection that we get sometimes from walking bare feet, and the manifestation of fungus, it makes the nail brittle, yellow, and thick. When we have nails like that, the way we take care of it is to actually, sometimes we have to remove the whole nail if it's very thick and it's putting an indentation in the nail. That indentation throughout the days, the years, can become a wound. So we want to prevent things like that. So if the nail is getting too thick, we have to remove the nail and give you something to make the nail come back better. Healthier. By the same token, we have to also look at the whole body to see if there are other vitamin deficiencies that may be also the cause of such problems. But definitely we need to make sure that the nails are as healthy as they can be, and this is regardless of age. And also one thing that causes nails to be discolored is trauma, and we don't think that trauma can be by a tight shoe. If the shoe is too tight, it's pressing on the nails. It can cause trauma, and with trauma, the nail is not as healthy, and it can become thick, discolored, and dystrophic as well.
And it can be catastrophic, especially in the diabetic patient and the patient with poor circulation. They can lose half a toes, a full toes, and 2 or 3 digits because of poor care. Because remember, as the diabetes advances and is poorly controlled, you are losing the sensation. So you can have a nickel in your shoes and you don't even know it. And by the time you take off your shoes, you have a hole now in there.
Well, I want just everyone, I'm going to give you a phone number. If this makes sense to you, if you haven't been to a podiatrist lately.
Not any podiatrist.
Yeah, not any. Not any. I'm sorry. If you haven't, let's just say that if you, well, there are people who haven't been even to a podiatrist, probably.
Right.
But let's get you to start right now. Let's go see Dr. Joseph over at the Adult and Geriatric Medical Center. And let me give you a phone number. Make an appointment, please. It's very important to do that. It's 954-489-1345. Remember, it's Pencil Talk Radio. Get that phone number written down somewhere, 954-489-1345. Just imagine you can get your feet all taken care of, and it's going to be so lovely. You're going to feel so good.
It's going to be the Adult and Geriatric Spa.
Yeah, that's right. The spa. That's right. That's what we were talking about. Well,
we have good news. We forgot to say the good news. The news of the day. We're going to be open on Saturday, starting today.
Fantastic. And what hours?
Those people that it's going to be from as soon as I leave the show, I go straight to the office. I get my coffee, go straight to the office.
Okay.
And probably until around 12 o'clock. Sunita and I, we are always in the office every Saturday.
Like 9 to 12?
From 9 to 12. So you can call the office. We always have a live person answering the phone. You can call the office, and if you need to be seen, if you have any emergency, because Sunita, one of the nurses there, she's lovely,
wonderful.
Excellent.
Lovely.
She's there every Saturday. And she goes and do work on Saturday. And
so why not be open, right?
And I'm there every Saturday. I say, Sunita, we have to open the office. We are
Smart.
here. And patients that would just happen to be coming by to see if we are there, we open the door, they come in, they get in, they say, you know what, we're going to make it official.
It is so wonderful that you just told me that. Okay, so we're open on Saturday. So
you don't have to go to a urgent care or emergency room for 4 hours, you know.
Yeah, I'm very happy to know that. So it's 954-489-1345, and of course you know that you've been hearing Dr. Mencia now for the past year.
And I tell you, if you see Dr. Joseph,
and
you say, where do you get these beautiful people in your office?
I said that when she walked in because
you see Dr. Joseph, her bedside manner is so wonderful, and I have never seen her as a patient. Mind you, I have never seen Dr. Joseph as a patient, but I always look at the feedback that come to me from my patients, and I always say, how was your visit with the ophthalmologist? How was your visit with the podiatrist? And they just love Dr. Joseph. Oh, she cares. Her hands are so soft. She cares so much. It's so good at what she does. She's so patient.
Well, I didn't ask her this, but her teeth are beautiful. I'm sure she's seen Dr. Rosemary, who is, of course, I mean, her teeth are so beautiful, and I mean, it seems like everyone you bring here, teeth are beautiful. So Dr. Rosemary must be doing something something good also. Well, let's continue with the feet. Now, a podiatrist, tell me the difference of where are you allowed to go? How high up to the knee? I've never.
That's a very good question.
As
a podiatrist in the state of Florida, we are allowed to work from bony, prominent, from the bones below the knee to the toes, but soft tissue to the whole leg.
Oh.
So if you have a soft tissue problem on the thighs, we can take care of it, not a bone problem.
Oh.
But as far as bone, we can do surgery below the knee to the toes.
So like lymphedema or those kind of problems that can go all the way. Oh, I didn't even know that.
See, I didn't know that. No, this is all wonderful. And then you talked about, Dr. Mencia, you said something about having ultrasound, and what would that do?
Well, when you go to a podiatrist, most of the podiatrists out there, they do not have a full lab to work with. So if the podiatrist is concerned about from fungal infection all the way to diabetes, Dr. Joseph has a full lab at her disposal.
Yes.
And if she needs any kind of blood test, it will be done. I am the medical director for the lab also. It will be overseen by me. And she also has a ultrasound with a technician, with a radiologist that read her ultrasound. So when she's doing an ultrasound in a patient, it gets read by a radiologist. So there is a third party there to make sure that we are providing the best of the best in healthcare.
So the ultrasound is, for instance, if I'm going for a breast check because they think there may be a little something and they have the ultrasound, that's what we're talking about. Now you can see further,
exactly.
Right?
And I have patients that they say, I'm not getting a mammogram. I am not getting a mammogram no matter what. But, I say, well, you can do an ultrasound. You can do an ultrasound of your breast as an alternative. So, we do that. When it comes to Dr. Joseph, if she has any concern, either soft tissue concern or vascular concern, then she can do an ultrasound. Because when you compare an ultrasound to X-ray, MRI, and all of that, it's less radiation. So it's sort of less invasive in comparison. And we try to move as holistic as possible in all our services.
All right, so now I have another question. We actually were in Haiti not too long ago, and my son slipped on something. He's a grown person, and he sprained his ankle. And I told him immediately to put on ice, but it still expanded, and it was a problem. All right. You, as a podiatrist, is that who he should have gone to when he came back here to the United States?
Absolutely. As a podiatrist, I can take care of the ankle as well because, again, bone from below the knee to the toes. But also, I want to mention, sometimes we forget, we say, oh, it's just a sprain. I want you guys to realize that a sprain can be as bad as a fracture. Sometimes it takes 2 months to get better, 3 months, because we have a tendency not to treat the sprain the right way. And a sprain, what is it? It's when all the ligaments are stretched to full capacities. We have several grades of sprains. If you have a third grade, that's really bad. So the soft tissues can stay swollen for a long, long time because the ligaments that are holding the bones together, if they're stretched, there's no other way. They become sick. They are injured. So we have to immobilize, and sometimes we have to put you on a cast because we want it to stay immobile. The less motion, the better. So the ligaments can heal to the best of their abilities, and so we can have a full productive ankle again. But if we don't treat it, it can be very disastrous. Can also lead to arthritis.
So then people, if they come to you, you'll know if it's a very severe sprain or if it's something simple.
Absolutely.
And what to do. And is it always ice rather than heat?
When it first happens, we do ice because it gets swollen. We want to put the swelling down. But throughout the days after that, we can do a combination of ice and heat to make sure, because the heat goes deep and relaxes the muscle. The ice will put the inflammation down.
So she is as smart as you said. You see, Dr. Mencia, you warned me. Yeah, she's smart. She's answering all my questions here. It's like my own personal podiatrist now. I now know where I'm going, right?
And that's the beauty of this show. Everybody's getting their personal nutritionist, their personal podiatrist, their personal dentist. So forget it. They got everything. Free service.
But talk about the feet and you as a person who's been in sports. And truly, you must have injured your feet. I mean, you've done a lot of things in sports. And so how do you protect your feet? What do you do?
Well, one of the things that I do recommend is that we change our shoe wear frequently. Mm-hmm. Some people will buy sneakers and they say, oh, I have this sneaker for 4 years, 5 years. And that's no good. You have to change, because the shoes is a cushion, like Dr. Joseph was saying. It's that cushion, and as you wear your shoe for a long time, then that cushion loses the elasticity. Yes. So you are having a hard surface that you are stepping on, and loses the principle of what the shoes are supposed to be doing. So you want to change your shoes frequently. And that's why it's good for people, when they buy their sneaker, buy 2 pairs, not 1 pair. Buy 2 pairs of sneakers, because you can alternate.
Absolutely. Rotation of shoes is very important, because the shoe has memory. So if you use that shoe to go to work and you use it for 8 hours, it remembers the imprint of your bones. So after a while, that cushion bottoms out, and it doesn't help anymore. It doesn't prevent anymore. So it's like walking on the bare feet. The best thing to do, like Dr. Mencia says, is to have 2 pairs. You alternate, and then like that we try to confuse the foot, so it feels better.
Mm-hmm.
I never heard that before.
And Dr. Joseph, you get people out there sometimes that I say, go and see Dr. Joseph. She can get you some orthotics for your feet, so that might help us with other problems that I'm trying to treat my patient, like lower back pain, hip pain.
Absolutely.
What's the difference between doing an orthotic or just buying a pair of inserts out there?
The difference is everybody has different feet. We don't have, no 2 feet are the same. So the orthotics that we do in the office, they are made specially for you. Your feet are the imprint of your feet is being taken, so it's specially for you. Like, for example, my left foot pronates more than my right. Uh-huh. So I need an orthotics to accommodate that foot. So it's the same thing for everybody out there. If you go over the shelf, you get something over the shelf. It might help for a few days, but after a while, it doesn't do you any good, because the foot says, oh, I can continue moving the way I used to. But when we do an orthotic specially designed for you, we take all the bony prominences, everything into consideration. And also, we have the ability to check the motion and give you an orthotics that's either semi-rigid or rigid or softer. But we have to make sure what type of foot you have. Some foot move more at different joint, because the foot has different joints. So that's what we do when we're giving you an orthotics that's specially designed for you and not something over the shelf.
And the depth of the orthotic, are they like the right foot and the left foot are at different depth, or are basically about?
It depends. We have to do a biomechanical eval to see, because some people need a little more of a heel cup on one side, and the other foot doesn't need to be compensated. Sometimes the foot goes in more, so we have to accommodate all these. So an off-the-shelf orthotics does not take that into consideration.
A lot of people don't realize, Anita, that even if you get your orthotics and God forbid you undergo hip surgery, then you have to redo your orthotic, because a lot of people, when they have surgery of the joints in the lower extremity, the legs won't be the same length anymore.
Absolutely.
No matter how good the surgeon is, it's always going to be a tiny difference, and sometimes a significant difference.
Absolutely.
I saw my aunt coming into my office, and I see her getting off the car. I go to greet her, and I see that she's limping. And I say, wow, 8 months after the surgery, and she's limping. So I asked her, are you in pain? She said, no, this is the way I am now. So I said, well, you need to see my podiatrist because you need, we need to compensate. But it was an obvious limp that you can see it at a distance.
Amazing. It is amazing. This is wonderful information. You can see why this show is so important. And every time we have one, whether it was the hormone replacement therapy and we had Dr. Coleman, it's always something good. And I don't think I'm trying to think, over the years, if I've had one or two podiatrists, and I do this 22 years, this is a wonderful subject because when your feet hurt, you don't want to go anywhere, you don't want to do anything. It's a very important part of our body.
That's the obvious part when they say, I need to see Dr. Joseph. The not so obvious part is many people out there that suffer from back pain and hip pain, and they don't know it's coming from your feet.
Well, we're going to go over to the Adult and Geriatric Medical Center, and the phone number is 954-489-1345. If we do that,
on Saturday.
Yeah, right. We're open on Saturdays, and Dr. Rosemary's now in the morning from 6:30 to 7. And but just write this phone number down again, please. 954-489-1345. Go meet Dr. Joseph. Get your feet taken care of. I'm going to go do it. I have to tell you that.
You're going to love her.
I'm definitely coming. I already love her now. Just looking at her, but I'm going to go and get my feet done also. So I don't know who you're going to bring next week. You keep surprising me and shocking me. I love this. Saturday mornings. See, I would go to Dr. Mencia on Saturday morning because it's not going to be as busy. Oh, you're going to have a good time.
Exactly.
So make the appointment, though. You shouldn't just drop in. Try to really call there at 954-489-1345. And I guess what we're going to do is say thank you very much for being with us this morning, Dr. It's Blonde Joseph.
We're going to bring her again.
One day we're going to have to bring the whole crowd. We'll have a big party here. We're going to do this on a Saturday morning and bring all these wonderful people who've been here. So thank you very much, Dr. Mencia and Dr. Joseph. We will see more when we see you again.